I'm Jeroen Tas. I'm within Philips responsible for connected care and health informatics. And when we talk about healthcare, we really talk not just about sick care, where people, go to their general practitioner when they have an issue. I'm really talking about health in the wider context. And what we see happening is basically a tremendous pressure on the system, because half of the population in the Western world is either suffering from a chronic disease or at risk of a chronic disease. So what does this mean? It means that we need a different system that helps people to, number one, live more healthily, and as they develop a condition, have better tools to manage their own condition, but be able to access care as and when and where needed. I think we're at a very exciting time where we can actually start deploying these kind of models. We're at a time where we can start leveraging technology to bring the care to where people are. So what am I talking about? Let's assume that you're a person, for instance, like my daughter, suffering from diabetes. Then every day you have to make about 150 decisions concerning your health. You basically need the tools to help yourself, to understand yourself, and to better take care of yourself. But that will not be sufficient. You need clinical experts to support you. If you look at elderly people, you also see that they typically suffer from multiple chronic diseases. You see that the people who have the highest strain on the healthcare system are typically people with multiple chronic conditions that call emergency help multiple times a year. So what if we can help these people take better care of themselves? What if we can have the care team optimize the way they provide help and care for those people? Then we have a real impact on the care. Now, what if we can detect much earlier if things are deteriorated? So if we have an early warning system that can give us an early warning to help these people and intervene before, for instance, cardiac arrest happens. So can we build in the systems that do early detection, build in the systems that intervene at an earlier stage so that we can avoid deterioration or acute situations? We can aggregate that information and analyze. We can analyze the relationship between symptoms, diagnostics, treatment, and outcomes, and make sure that that feedback loop gets better and better and better. And we do that by aggregating data. So where do we see this going? We see increased leverage of technology. So, for instance, at Philips, we developed HealthSuite digital platform, which is essentially a core infrastructure to get data from devices, to get data from different data sources, bring it all together, and create that full profile of the patient. Once we have that full profile of the patient, we can provide way better care because we see things coming earlier on. If there's an emergency situation, we can capture the right background of that patient, the history, the medication, the allergies. All of this will help better care at the point of care. But more importantly, we will be able to aggregate that information and build that intelligence into the system of care. That will help patients take better care of themselves. That will help care teams to intervene early where and when needed. And that will help clinicians to create a much better view of that patient and therefore provide a better diagnostic and therefore provide a better treatment, and all the while keep learning every day with every engagement. Applying this technology, we're really opening up a whole new world of medicine. We're opening up a world where medicine can be linked to the way people live, work, and play, and where medicine becomes one of the enablers of health that include the way we behave, the motivations we have, and the social environment in which we live and work. So we believe we're at the beginning of a completely new era where we provide health to everybody and where we empower people to take control of their own conditions, but always backed up by the knowledge and expertise of a care network. I think it's a very interesting future indeed.